Anyone else see something wrong with this image? Hi everyone, Dr. Geoff Schneider here, physiotherapist, epidemiologist, and researcher. At Evidence Sport and Spine, we don't just read the research, we often write the research. And today, I'm here to talk to you about a very important topic of neck pain and how we can take the evidence and apply it to generating better patient outcomes. For this discussion, I examined 4 recent research papers. The papers focused on risk factors for developing neck pain in those that work in an office and around a computer, the effects of sitting for too long on neck and low back pain, and what we can do about it to reduce being absent from work and improve workplace productivity. The research is pretty clear in identifying key risk factors for developing neck pain in the office. Number 1, sitting for too long. Number 2, keyboard position that's too close. Number 3, high sense of muscle tension and stress in the workplace. And number 4, again, just to name a few, very little work task variation, doing the same things over and over again throughout an entire workday. Well, let's have a look at the basic anatomy. Here on our spine example, what you can see is we've got natural curves in the spine. If we could sit all day in this position with the natural curves, we're going to reduce load and repetitive strain to the spine. Trouble is, most of us don't sit that way. We sit for too long throughout the day. We have very little variation in tasks. We tend to do the same repetitive job over and over again for a long duration. What this does is it overloads the tissue on the spine, which then eventually generates neck pain. The easiest way to mitigate these risk factors that we discussed is to, number 1, rather than sitting for too long in a poor position, we want to sit in an ideal, neutral position that feels very relaxed, very natural, and at least every 30 minutes we want to get up and move around, change our position. We also know that if the keyboard is too close, very much like a T-Rex type position, you can see what it does. We're adding a lot of tension in through the shoulder girdle, and we're putting ourselves in an awkward position that can create neck pain and stress over time. To mitigate the sitting issue, very, very simple. We get up and we move around. Every 30 minutes we want to get up from that position and we want to change our work demands, we want to change our tasks. If we're at the computer doing the same thing day in and day out for hours at a time, we're increasing risk for something that we don't need to develop because we have control over that. We can get up, we can move around, we can change tasks, we can regroup, we can talk to a colleague, get water at the fountain, come right back to our job demands after even a 2-minute break. So we've talked about risk factors for developing neck pain and what we can do to prevent it. Now let's move on to management. What can we do on a daily basis to help ourselves not develop neck pain in the first place? And if we have neck pain, what can we do to get it better in a short period of time? What the evidence points to is exercise. We talked about workplace ergonomics. When you combine that with exercise therapy, that a physiotherapist is well positioned to design for you on an individual basis that is progressive over time, that's going to challenge you over time. We look at neck specific exercises, shoulder specific exercises, mid back and low back specific exercises to help you prevent neck pain in the first place in the workplace, and or if you have neck pain, to make it better. Reduce sick days from work, make you more productive at work and feel better about being there. We've discussed mitigating risk factors for the development of neck pain or prevention of neck pain in the first place. We've also discussed what you can do to help yourself when you do have neck pain, feel better and become more functional. When you do need to see a qualified healthcare professional, make sure you choose a multidisciplinary center like Evidence Sport and Spine. We can provide you with a detailed clinical examination, which will inform a diagnosis developed into an evidence-based plan to help you manage your neck pain and get back to enjoying your quality of life. If you have any questions or suggestions for further educational videos, please comment below. If you'd like to come in and see us, please give us a call. We'd be happy to see you. Otherwise, thanks for joining us, and we look forward to seeing you on our next video.